All right, PFRANKMD fans, we are here for our virginal debut of QWO, which is a relatively new product. It has been used as a medicine for other indications in the past. The medication is collagenase, which breaks down collagen. Now, one of the issues with its new indication, which is cellulite, are these fibrous bands that connect the skin down to deeper tissue, sometimes even down to the muscle. Now, as we all know, we've spoken that there are many reasons why we have cellulite. There are irregular fat deposits, there's loss of elasticity in the skin, and there are fibrous bands that cause deeper contractures. Now, these are probably the hardest of the cellulite factors to treat, and now we have QWO. Now, this is a treatment that is usually performed in 3 different treatments. It's FDA approved for the moderate to severe dimpling. Of course, we can use it off-label in every area of the body, and we hope to learn a lot more about it. This is going to be our first treatment with this young patient. I would call this more mild. It is a treatment that you space about a month apart. You'll see me marker. Let's do that right now. I want you to kind of flex the tush for me. Good, relax. And again, you can treat a few, you can treat a dozen. Flex again for me. Good. This is a deeper one here. Good. And sometimes I want to see if we can release some fibrosity, which is very common underneath the banana roll. Again, the injection technique is quite simple. You'll see me do it. It's almost like 3 little injections into each area. The patient will bruise. It could last up to 2 weeks. You see me do my Biostim treatments, which can cause a week or 2 of bruising as well. My hope is that QWO will add to the treatment armamentarium to get the best result. As we've described before, you get the best results by combination treatments. We do a lot of shockwave and radiofrequency ultrasound treatments with Emtone. We do a lot with my proprietary kind of formula of Biostim with hyperdilute biostimulatory filler. And I think QWO will be great for those, probably those more moderate to severe dimples that are really, really frustrating. We've used subcision in the past for that. We've used filler in the past. And although it works, we're always left wanting a little bit more. So I'm hoping QWO just that, and you're going to stay tuned, and hopefully it'll be a very tolerable and successful procedure.
Thank you.
All right, here we go with the treatment. She is marked out with these little dimples. We're putting in 0.3 cc aliquots. You're going to feel a little pinch here. 0.1. And then you change direction. You want to make sure you spread out the product. Some people put it all in one big syringe. Some people put it in little syringes. Good. My feeling is we will learn a lot about how much to put in. Smaller dimples, bigger dimples, superficial, deep. Nothing is purely mechanical. There's always an art to everything. Fairly simple. I'm assuming the bruising will come out in a few hours. So these were very superficial and very small. So I'm actually choosing to put a little less in them as opposed to the deeper ones that are more bound down. Again, with everything I use a little judgment. This was a deeper area. Here you go, poke. How's the pain? Not bad. Unfortunately, I can't do it to myself to test out as I do with most things. I'm going to come on this other side. Three directions. This is very typical, not of the treatment, but of anything you do to the bump. You get the booty reflex, it bounces up at you. So you could really use, because it's almost like injecting Botox or water. It's very thin. It's not a thick, viscous product. So We go down here. You could really use the smallest of needles. I'm using a 32 gauge here. I think they recommend a 30, but that's just how the studies were done. So as with anything else, we find out what works best for the patient and the treatment. And that's it. That's QWO, people. Let's stay tuned for some bruising, some follow-up. We'll see you in a month.